آمال هل تسمعين؟
أيوة أسمع.
ما قادرة أسمع شيء. تكلمي تو؟
مساء الخير.
أوكي. أهلا مساء النور. نبدأ؟
أحسن نبدأ.
أوكي بسم الله الرحمن الرحيم. Today I will speak about mental health among healthcare worker, and I will compare between the front line and non-front line of the healthcare worker. In Oman, the first 2 cases was reported in tested positive in 24th of February. The initial implicated the spread of COVID in Oman was among people or among Omanis who traveled abroad. When they came back to Oman, they tested positive. As the first time was only 2 cases, and from that date, 24th, until today, the cases reached, the total cases reached 123,484, and the total recovery is 114 and 963. So there is, of course, there is a big difference between February and now we're in December, reaching December. The number of cases have been increased rapidly. So as for healthcare worker, of course, the growing numbers of suspected cases and confirmed cases, that will make a workload on the healthcare worker. And this workload, with time, it became overwhelming. The timing, it was long, irregular hours, and of course it was continuous and heavy duty. And even there was a decision of stopping all the regular leaves. And, you know, for example, we've been through the summertime and there was no annual leave for the healthcare workers, especially the front line, until the cases settled a little bit in Oman. So the evidence suggested that stress associated with period of all of the stress, it will awaken the immune system, and of course it will increase the risk to have a disease. In addition to having high risk of contracting COVID, again, it is there is a big possibility to have a poor mental health outcome, unfortunately. And studies also showed that significant peak of poor coping. It's not only the, okay, there is a big load of work. As I said, it was really overwhelming, but unfortunately, we can say studies showed there is a significant poor coping, maladjustment, and development of emotional disorder during this time, during this, any crisis. For COVID-19, there was emphasis of the importance of 3 areas, which is the social, psychological, and biological health. So we need to have a concentration on the biological health. Again, distress commonly being reported among healthcare workers. Often it's outstanding, comparing to the general public, especially if it is something related to health disease. Now the question remains, okay, now we know the sound is not clear. I don't know. Is it better now? Now, again, we can say that we want to thank you. We want to compare between the front line and non-front line, and I will talk about the difference between the front line and non-front line. So we did a study in Oman, and this study was the main objective for it was to compare psychological factors and the sleep status of the frontline and non-front line among the healthcare worker. And we needed to understand the demographical factors that have potential impact in preventive or increasing the problem among this healthcare worker. They said there's no voice.
الصوت واضح عند الباب. There is voice for some people.
Okay. Okay, so the method, the first thing, this what we tried to do, we did this study in April, so at the beginning of the COVID, and we tried to make it among different healthcare worker setting in the country. In Oman, it is a free healthcare system divided into primary healthcare, secondary healthcare, and tertiary healthcare, and polyclinic. So according to the Ministry of Health, actually what we do as a start, usually in a case it will go to the primary healthcare, and if there is any complication it will go to secondary or tertiary, whatever it depends on the case, it depends on the severity of the case, and of course on the catchment area that they're having. Of course, one of else please.
Seems that Dr. Mona got disconnected. So I think she's here.
Okay, sorry. Okay, so our method was, of course, one of the main obstacles was the social distancing, and even giving papers as before, or even interviewing people was really one of the obstacles. So we decided that we are going to perform this research through the emails and social media from different from different regions in the country. So after the initial contact, potential respondents was also asked to disseminate the information among their colleagues. So we had every region, there is a certain people that we sent to them the questionnaire, and that people, they will separate it around them for the other people. In Oman, there is a 11 rate. So as I said, we contacted certain people, and from there it was disseminated. And then the sample size that we took, it was 0.1 was calculated, and this related to the SARS outbreak report. So what we thought that it will be around 35% psychological comorbidity it might happen. So to allow the analysis of the relevant subgroup, we tried to increase the size by 50%. At least to reach 1,070 participants. We disseminated the forms. It was in Arabic and English. And everyone who, before they filled the form, there was a consent, and then they will start the form. they will start filling the form. So the outcome that we tried to study, it was mainly in two things, which is the DAS and the Insomnia Index. DAS, it contained the depression screening checklist, depression and anxiety and stress. And this DAS 21, it is used before, and it has a good subscales. I mean, the cut-offs for depression, if it is more than 10, and anxiety more than 8, and stress more than 16. Insomnia Index, it is a 7 items. It is a self-report. Of course, both of them, it is a self-report questionnaire. And there was, if it's 0, there's no problem, for a very severe problem. And the total number can be from 0 to 28. And the cut-off score, it was 14. Okay, we studied again the demographical factors, which is nationality, gender, age, marital status, the type of medical setting, which is it primary healthcare, secondary healthcare, tertiary healthcare, or polyclinic, whether it was this healthcare worker, he was or she was this one engaged in clinical activities, which is diagnosing, treating, providing, or nursing care to the patient, or someone who is in the healthcare worker, I mean, in the healthcare system, but not in direct contact with the COVID patients. So the people who is in a direct contact, those people who we call them the first line healthcare worker. And the people who is in, for example, in a places that they're not really dealing with the COVID, I mean, maybe with the planning, with the for example, in the administration, and this we call them the second line healthcare worker. So those who responded as diagnosing, treating, providing nursing care were identified as healthcare frontline. And if there is no contact, so we call them the non or second line worker. Also, we differentiate between the job type, like physician, nurse, allied healthcare professionals, and the allied healthcare professional, like pharmacists or other medical staffing, including lab, technical, or x-rays. And this, the participants were also asked to whether if they have previously sought any consultation for psychiatric disorder. I mean, if there is any history of any psychiatric disorder before the COVID. Of course, we took the ethical approval. We used the SPSS for the statistical analysis. As a result, as I said, it took like online survey. It took 2 weeks across the country. The total, we received around 1,167 questionnaires, but we removed 28 of them, which was not complete. So we included 1,139 questionnaires. You can see in this in the table, I mean, the difference. We did the total number, and then we differentiate between the frontline and non-frontline. And then we divided the variance, like the age, the gender, the nationality, the healthcare type. What's the type of job, nursing, physician, or allied healthcare worker, previous sought any mental health problem, marital status, number of the cases that they saw, and type of the healthcare they're working in. In general, we found that 23% of total, if we're talking about the total, 23% of all healthcare workers that contributed in this study was having a depressive symptoms, 34 of them having an anxiety symptom, 23 of them having a stress, and 18.5 having an insomnia problems. So if we're comparing between the front healthcare worker and non-healthcare worker, we found that in depression there is no real difference, statistical difference, but in anxiety, frontline healthcare worker and non-frontline healthcare worker, and we found that the healthcare worker, the frontline healthcare worker, they're 1.5 more prone to have psychological problem comparing to second line or non-frontline healthcare worker. So, of course, we had a limitation in this study. First of all, as we know, it's a large survey and it required a lot of logistic, which was unable, we were not able to do it during the lockdown. Also, it was an online survey, and you know very well that if it is online, it means that it will reach to people, only to people who are able to use the internet. People who is not using it, then they will not contribute in this study. Other thing, the DAS and Insomnia Index, of course, it will not replace the interview. If it is in the normal situation, the better way that we care worker, we do like one-to-one interview. It's not only through the questionnaires, but in the same time that the checklist of DAS and Insomnia are the only viable tools that we conducted this study during the current circumstances. Another thing from the limitation, that it's really important that we quantify the presence of psychological disorder. Within this view, it is not clear whether the observed mental health outcome constitute adjustment disorder, acute stress reaction, or present chronic type. As I said, because it is very short period, we did this study in April, and the first case was in end of February, so we didn't even it was a short period to decide whether this is only an adjustment problems or it's really a chronic problem that we have to intervene. So in conclusion, within the background of high rates of poor coping among a healthcare worker, even before the pandemic, studies needed to explore more how frontline compared to non-frontline in this regard, why this big difference. And this study, it highlighted and appeared to be with other studies in suggesting that COVID, because there's other studies gave the same outcome. One of them in China, and again, it gave the depression and anxiety, and insomnia was more among the healthcare worker comparing to general population. So we need to know more what's going on and how they are really can cope, and I think Dr. Amal will speak about it. And in comparing the frontline and non-frontline, the present data suggests the frontline were likely to be younger, non-Omani physician or nurse who were single and working in primary health care. So what we found that in the primary health care, they're more prone to have these problems comparing to other healthcare system. I think I'm on time, inshallah. Thank you. And if any question after Dr. Amal. Dr. Amal.
Thank you, Dr. Mona. So I'm Dr. Amal Ambusaidi. I'm a consultant psychiatrist from Sultan Qaboos University Hospital. I'm really glad and honored to be among you all today. My talk is going to be very short. I think I have 20 minutes. So as you all would expect, it's really hard to talk about managing stress in 20 minutes. It's rather stressful to talk about it in 20 minutes. As Dr. Muna was talking, I remembered that joke that was circulating when people were talking about conducting such webinars online is like summoning spirits. So people would say, are you there? Are you there? Can you hear me? So hopefully this is a summon spirit. So hopefully everyone can hear me clearly. So the stress response, I trust that most of us are familiar with the stress response and the fight or flight sort of response, the physiological consequences, and the whole hormonal and chemical reaction that our body goes through when we are under stress. And there are different components that contribute to the stress response, which interact and influence each other. So in the COVID-19 case, the stressor is very obvious. It's this pandemic that is more like the black swan effect that came all of a sudden, shook us all, shook everything we know, and the world is not what we used to know anymore. So we're dealing with so many things. It's not just the health hazards that we're dealing with, but it's the change, the magnitude of change, the increased demands, and not only on the health systems, but also on a personal and economical level, the huge amount of uncertainty. We are faced with a lot of ambiguity, a lot of uncertainty, which is the perfect media to cultivate stress, cultivate anxiety. So it also involves our previous experiences and how our expectations out of the stressful events are shaped. There are the physical responses. There are the physical responses that we also expect with stress, which is what we experience in our body that most of us are familiar with, so I will not go through them. And the psychological responses Dr. Mona talked about, the self-reported psychological symptoms, the health workers in the front line and the other health workers reported, which could contribute later into one of the psychological disorders that we all know about. And there are the behavioral responses, which translates into what we did and what we are doing currently to manage this stress as health workers. So it's very interesting that there is a lot of highlight recently in studies on showing that it's our attitude towards stress what makes it stressful or not. So any event is really shaped by whether we consider them as hazardous to us or we consider them as stressful. So it is more about your mindset. So in a decreased, let's say, amount of or number of staffing could be challenging for someone and challenge them to do more, and it could be very demoralizing and inhibiting for other people, and they consider them as increased load and very stressful. But the interesting thing is, for us as a human, there is an inherent belief that feeling anxious or depressed, which is rather expected and normal reaction to stress, is considered for most of us as a human as something abnormal, as something wrong. So whenever we experience anxiety, we panic about it. Why am I so anxious? Why am I feeling depressed? But we also know that it is an essential part of the stress response. So I will not be pessimistic if I say that the traditional disaster plans are reactive more than proactive. And we've seen this. We've seen how COVID-19 has proven novel in many ways. And the proper response to disaster and any stressful event that we anticipate, we know that stress is inevitable. It's going to happen. It's a matter of when and how. It's not if. So it's all about having policies and practices in place to anticipate various emergencies, what determines how our stress response is going to shape. And we've seen it. Everything in the medical supply chain has proven unprepared. We've seen it on TV. We've seen it everywhere. Human resources, our training, everything was challenged by the COVID-19. And the interesting fact about this pandemic is, with all other stressful events, with all other disasters, like take a hurricane or take an earthquake, we know that there is a starting point and there is an influx of cases and increased demand for some time. We know that there is an end point to this disaster, but for the current stressful event, the COVID-19, it is open, it is going on, and as we all know, the world is not the same anymore. So what I want to focus on in my talk is the concept of resilience in the face of stress. How can we become more resilient as individuals? And most importantly, how can we become resilient as organizations, as healthcare organizations? Because guess what? In my book, it starts from top to bottom and not from bottom to top. And in many instances, I've been asked to give workshops in stress management. And all the time, people in organizations, whether healthcare organizations or other organizations, they want you to sit with their employees and teach them and expose them and develop their coping skills in dealing with stress. But I end up in these workshops facing individuals who are very frustrated, who are talking about policies, procedures, everything that deals with top management and how the environment they work in is not making their job easier. So it's much better to start from top to bottom. So what is resilience? Resilience is not the definition of just bouncing back from adversity. It is not going back to the status quo. It is not going back to how we used to be before COVID-19. So resilience implies that we are advancing despite adversity. So despite of having COVID-19, we originally had visions and goals and plans. So are we still focused on our vision and goals and plans and we're headed towards them? Maybe slower. Maybe we needed to cut corners and do other things that we're not used to do, but still moving forward despite of adversity. So this definition also applies to us as individuals. Are we still growing despite of having to live with COVID-19 and work in an environment where we have to deal with COVID-19? So, of course, resilience is shaped by many factors like our beliefs, our access, information we have access to, our biases and skills and education and mental processes and behaviors. So there are, where I studied or where I focused and trained on resilience, we focus on 6 domains of resilience. If we focus on these domains, we have better luck on developing the 6 domains together. So these domains are interactive. When they go down together, and when they go up together, and you can choose to focus on one or the other. And even if you find yourself deficient in one of them, the good news is these can be improved, you can work on them, and resilience is really a lifelong process. So domain number 1 is vision. And I've seen so many organizations, whether healthcare or non-healthcare, that lacked vision, and that really translated in what they did in their COVID response. So vision is about really knowing what is the big vision for your organization or for you as an individual. What is your purpose? What are your goals? And to have clarity about them. And why is that? Because when there is stress, there is chaos. When there is stress, there is demand, and you might find yourself responding and becoming reactive rather than becoming proactive and working towards your original goals, because your focus can be easily derailed because of the stressful events. So it's very important to be in touch with your vision, very important to have clarity of your vision, and most importantly, that all of your actions to be congruent with this purpose, goals, and vision. So organizations that their actions, their legislations, everything they come with that are not consistent and congruent with their vision, they fail in their resilience and they fail in their stress response. The second one is composure. And this is this make a lot of sense because we need composure. We need to be able to deal and regulate our emotions. And of course, I know all of you have been exposed to tons and tons of information on how to regulate your emotions, how to practice mindfulness, how to do this and do that. And it's easier than practice. So we as a human, we have natural inclination to negatively interpret ambiguous situations. But interestingly, this makes people 6 times more likely to show symptoms of depression when they have this negative inclination compared to people who have positive inclination. The importance of composure is if you are able to regulate your emotions, that means you will look into change and look at it as more of challenge, and you will be also able to look into opportunities that this change brings with it. And this composure and ability to regulate your emotions is also going to help you problem solve and have intellectual thinking or critical thinking. The third element is reasoning, and that is having the creativity and innovative problem solving. And here, during the stressful times, we all might face, we might hit the wall. And it's very important to be resourceful, and I would stress on being resourceful in your organization, to be able to find the resources, to be able to find the support, to know where to go and to whom to go to access support when you're faced with stress. So if you have this reasoning and if you have the mental attitude of resilience, change will be welcomed. So any corporation that have the reasoning well built in it will welcome change, because change means more opportunities. The fourth factor, which is tenacity, is our ability to learn from our mistakes and to have realistic optimism. So realistic optimism means that I am aware of all the challenges that I might be facing, but I also believe that I will be having all the resources, the problem-solving ability, the coping skills that will equip me to deal with these challenges. So it's not like everything is gonna be blooming and pink and stress-free, but it's anticipating stress, but with the belief that I will have the resources to deal with it. And number 5 is collaboration. And we've seen this. This is actually what we're doing right now. We're collaborating together to share information. Dr. Mona shared about her study. You're going to share about your views, and I'm going to share about my views. And this is the whole concept of collaborating. Humans are social beings, and we are hardly wired. Our neurons are wired so that we connect when we are faced with adversity and when we're faced with stress. So this is one of the most important domains for us to face stress. So having a buddy system in your hospital, having a buddy system in your personal life, having a support group, and also having so many policies and services in your corporation, in your organization, that you can access if you face difficulty that you cannot deal with alone. And the final factor, or the final domain, is the one that you've been hearing about probably for the past 9 months: healthy nutrition, quality sleep, regular exercise, and all the physical aspects of health that helps you restore your BDNF and brain-derived neurotrophic factor, that helps you deal with stress in a more efficient way. I want to highlight leadership. So what happens with people who work in the health system is that we present them with information that tells them that they are at high risk of having psychological consequences with regards to the stress resulting from COVID-19. There is abundance of research now coming that is telling us. And there is also research telling us that even people who are not in the health sector are facing this. So we tell them that they are a risk group. And even before COVID-19, we know people working in the health system, especially in certain specialties, are more prone to psychological challenges and suicide. And when we tell them that we know this fact, And you guys have all the brains and access to these information, but we don't have any policies, we don't have any procedures in your organization that will help you go through this. You can imagine how dissatisfying and demoralizing this fact could be. So well-led businesses survive. And of course, we know that if leadership is on the boat with you, that means that resilience has legs. Resilient organizations are those organizations that are fluid and flexible and are able to adapt to the change, and they are able to identify deficiencies and work on them. So very importantly, so dealing with stress is not responding to stress. It is having these policies to begin with to deal with any future stress and not only the COVID-19. And we can summarize them in three, let's say, approaches. The approach number one is to protect the mental health by reducing work-related risk factors. So it's very important to measure risk and who's at risk of stress at work, what are the specialties, and also to measure and audit and find out about what people are experiencing. And of course, protect mental health by reducing these risks. The number two is to promote mental health by developing the positive aspects of work and resilience of employees. And this is a huge talk about the environment, positive environment, and what are the policies. I'm going to talk about them, but every organization needs so that I feel safe and I know if I experience stress, I'm in safe hands and I can access these very easily. No discrimination, no stigma. And the third factor is to be able to address mental health problems regardless of COVID time, non-COVID time, to be able to provide mental health services and address staff problems, because we know when there is increased stress, people are more likely to decompensate and have relapses in their mental health. So I want you all to think about your organization, and I hope that there are leaders among us here, and these are some of the, let's say, policies and strategies that are recommended to be in place so that your staff feel supported when they are faced with mental health challenges or they are faced with stress, increased demand, like what is happening now with the COVID-19. So do you have a mental health policy at work? Is there an equality and diversity policies? Is there a stress management policies and strategies? And I don't mean courses. It's more like policies and strategies. Are there policies designed to combat discrimination, harassment, bullying? And is there an occupational health policy and operational framework? And are there any supportive courses or exposures of your staff into developing coping skills, communication skills, conflict resolution, which can aid and help your staff into becoming more resilient? So I'm going to spend the last few minutes just giving tips for communication and disaster communication, or let's say stress response or communication during difficult times is huge, and it's very important, and it's an essential part, because this is how top management connects with the individuals who are basically the backbone and the skeleton of the health services. And if there is disconnection between the two, they might be still functioning somehow, but it's not optimal. So tip number one, when there is a concern or anxiety is valid, it's good to acknowledge it rather than try to change it. And this has been very, very relevant at the beginning of the crisis. I've been hearing people who work in the health sector who say we don't have access to PPE, we don't feel safe at work, things are not clear to us. And when they address higher management, these concerns have been brushed off, or they've been counseled into things were going to be fine, things are going to be all right. And of course, this takes credibility away from management. Honesty would be questions, and people would perceive management as not hearing, and sometimes even jump to conclusions like they don't care. So which may not be true, but there is this gap of communication. It's not validated. So when there is a valid concern, validate it, agree with your staff, and sit with them and look into ways to work around it and improve it. And the most helpful thing is to provide a supportive presence, to check in and actively listen. So I've seen it work like magic in many organizations when the top leadership would just check in on daily basis, whether it's by email or a video or just go on the floor. And I know that's limited during the COVID-19 because of the physical exposure, but just being present there and actively listening, taking feedback from staff, and at times also normalizing feelings when appropriate. So it's highly recommended that top management go and say, I go through a lot of stress during the COVID-19, and I take a daily walk, I drink lots of fluids, and I sleep well at night, and I check with people I love. So such practices not only humanize upper management, but also normalize feelings of people who are feeling the same. Also use past actions to predict the future. Your staff need to feel confident, especially at time of uncertainty and ambiguity. So take from what they did in the past, present it to them to build that confidence and trust environment. Also, model desired behavior. It's very important to model desired behavior, but it's more important to choose the right model for the right audience, whether it's top management or it's the head of nursing or it's somebody who works in administration. Who is the audience and what are their needs? Also, motivate change in behavior and thinking. And this has proven to be very relevant in this time, like using reminders or prompts that people might receive. We've been receiving in my organization messages that reminds us of taking care of ourselves, spending quality time with loved ones, or eating well and sleeping in a better way. So these messages not only show that you care, but it also gives clear instructions for people who may lack structure and need instructions. And also motivate change in behavior and thinking by using these prompts, and counter negative messages with positive ones. In this time of information flood, where we are overexposed to information from all over the world, it's very important that we limit social media time. We counter the constant messages that we receive with positive ones. So your public relations, whatever department you have, human resources needs to develop content that you spread to your employees that would encourage them to replace negative messages with positive ones. An important aspect is also to increase the healthcare workers' sense of control. And this is the concept that we refer to as self-efficacy. The more you feel efficacious, the more you feel like you can change the environment and you have control over the uncontrollable, the more your positive feelings will increase, and you will cultivate that feeling of you can do it, you can survive through this adversity. So not only emphasize and repeat practices that people make them safer, because people can tend to feel that everything is out of control, I can catch an infection, or so just focus on the aspects that are under the direct control of your health workers, and also provide them with information that is coming every day, because now we're learning more and more about research. So such reminders cultivate a sense of control and self-efficacy. And again, reinforce social and emotional support. And as I mentioned earlier, there are lots of ways to do that, like a buddy system, like a support group. I've been anticipating that so many people would be reaching out to me when we announced that we are providing, psychological counseling for people who are in the front line. But we hardly had any people coming, and I'm trying to fill in the gap here. And I think sometimes it's because of good leadership, direct leadership, sharing information, sitting with their buddies in their workplace, whether it's an ICU or accident and emergency, wherever, and sharing that information. So buddy system works in these situations, and people can also watch each other for signs of stress and listen to each other, and positive behaviors can be reinforced when you're watching your buddy system practicing them. And the final point is recognize new challenges. COVID is the new definition of new. It has brought so many challenges for me as a psychiatrist. Not being able to show my facial expressions, my empathy to my patients, and not to be able to read my patients fully because they are wearing masks, has been a huge challenge. And not only because there is a limitation in communication, but it's common for people to feel angry, sad, and frustrated, because that natural element in that natural physiological hardwired response in their neurological system, which is showing empathy to others, is defective. They cannot show it, and they cannot read. So it is common for people to struggle with this, and they are at increased risk of compassion fatigue. So having, again, a buddy system, employee assistance program, professional mental health support services can also help with this. And again, another challenge is the online training and communications. I've done the basic life support. For me, it was fun because most of it, I've done it online. I'm an introvert. It worked for me, but I know that so many people learn in a group, and so many people learn by sharing and practicing with other people. So that's another challenge. So please recognize these challenges, discuss them, derive the strengths and the take-home messages and the learning opportunities from them. And the last point I'm going to finish this presentation with is, we all know that strategies to address mental health points towards net benefits. When we think in terms of return on investment, we know that cost-benefit research on these strategies just tell us that every dollar we invest can return as much as $4 when we invest in improved health, when we invest in mental health procedures and mental health strategies and practices that promote better dealing with stress. So I hope that all of us invest in our mental health, and I hope that organizations identify the need. And the take-home message from COVID-19 is, we need mental health policies in place in our organizations to be equipped to face all these increased demands and change. Thank you very much. I don't see Dr. Mona around. I'm trying to read your questions. Somebody here, Al-Hasina Bashir. Al-Hasina Bashir says, kindly conduct a webinar on communication skills to raise our concerns to higher management working under stress from work. I do conduct communication skills workshops for organizations and also for health workers in my institution. And of course, I cannot highlight enough the importance of communication and different sorts of communications and communication channels. So it is hugely important. Thank you, Al-Hasina. Dr. Mona is here?
Yeah.
Oh, you're here. So I don't know how we're going to go about questions. I don't know if people have any specific questions to Dr. Mona or me with regard, or if they have any comments or anything to add, to share their experience or knowledge, or Even people who want to talk about the amount of stress that they have been going through, and what services have been accessible for them, or what did they do on a personal level to combat stress.
Here there is a comment, طيب, it seems a little high starting with such a high percentage of 5.
طيب, very nice and clear.
I think he means the among the healthcare worker.
Okay.
In the not in the questions, it's in the chat.
Okay, chat.
This percentage, it's not only in Oman, it's everywhere almost. The healthcare worker suffering from such stress. But as I said, one of the things that we don't know is this really يا رب, is this really an adjustment, or it is a disorder? So we need more studies to confirm such thing.
Yeah, I think the most important conclusion is to know how distressed these health workers were at the beginning of the crisis, at the beginning of the COVID-19. And as you said, Doctora, it will be very important to follow up and find out the percentages of these people who turn to be having adjustment disorder, acute stress reaction, and so on.
I think there is no more. Okay.
Is there any, I think we have like 10 minutes. Is there anything you want us to focus on or talk about in the last 10 minutes? So Dr. Mona, are you aware of any other studies similar to yours conducted here in Oman?
Yes, there is one more study done by Dr. Faryan and Dr. Nawal from Royal Hospital. They did again among the healthcare worker in Royal Hospital, and if people from outside, people who hears us now from outside Oman, Royal Hospital is hospital.
Yeah, so the voice is disconnecting, Doctor.
Cases. Of course, there is many. Unfortunately, my connection today is bad. Okay,
so was the result consistent with yours,
they
Doctor?
conducted almost something similar to our study, and they found out the stress percentage among the healthcare worker was higher than what they expected.
Okay.
Doctor, kindly.
Okay, those of you who are asking, I work in Sultan Qaboos University Hospital.
Doctor, they need your.
Okay, I'll put my email address here. I don't know if this is allowed. Nobody told me the rules, but that's my email address. I don't know, people here, are you aware of mental health policies in your organization, whatever is the organization you're working in during the wake of the COVID-19? Have you been aware of any initiatives conducted in your organizations to address your increased needs? Because we know we had different initiatives in our hospitals where we informed health workers that counseling services and supportive psychological services can be accessed by self-referral, but I was underwhelmed because
I think there is no more question.
Yeah.
So.
Okay, so thank you very much.
All.
Dr. Mona, you go first.
For listening, and I wish that I would like to thank you all for this important part of the current situations.
Okay, so the situation which includes the health worker as a part, a general population as a part, an isolated patient as another part. I would like to have more resources on the matter. The question is not very clear, Mataz. What kind of resources? Because you're addressing different populations. So we focus today on health workers. Thank you, everyone. So if you have any questions, you have our email, my email, and you can address us for any specific questions. Thank you all and have a good night.